Welcome back. Billionaire entrepreneur Mark Cuban out with some rare praise for the Trump administration surrounding its efforts to lower drug prices. Bertha Coombs spoke exclusively with Mr. Cuban. Joins us now from the Health USA conference in Las Vegas. Bertha.
Hey, David. Yeah, Mark Cuban has really been on a mission to bring down drug prices. That's what Cost Plus is all about. And he feels that the Trump administration is really making a good start at trying to combat that with Most Favored Nation and with TrumpRx. And in fact, he's all in when it comes to TrumpRx right now.
We gave him our API. They're going to be a referral site. We're feeding them daily updates because with Cost Plus, as our volumes go up and our prices go down, we pass through those savings. And so it'll be great for us. We're really excited about it. I think it's a great thing. This administration completely different. I'm not saying I'm a Donald Trump fan now, but credit where credit is due. They are trying their best to reduce the cost of prescriptions and of health care and of insurance. Now, they know when I talk to them that all these things I just mentioned to you are the core issues. And what they're doing with TrumpRx will help, but it's just superficial, right? It's not going to change the game and change everybody's lives, right? But at least I give them credit for trying.
That's what he talked about. He said TrumpRx is a good start, but that is about a cash market. And yes, you'll have Pfizer on there and you'll have AstraZeneca and others. But one of the things he would like to see, especially as they negotiate these issues during the shutdown for the extending the tax credits for Obamacare, is to add in a provision that would say when people pay cash price because they're not being covered for a drug, they should able to apply that toward their deductible. Here's what he had to say.
As part of these conversations we have in opening back up the government, particularly with the premium support for the ACA plans, they should add to that or, make it part of that in other state legislation that, hey, anybody in this state that buys at a cash price, send it to the insurance company and they have to apply it to the deductible because we're cheaper all the time.
There are a handful of states that have started to do that now. In Texas and Tennessee and Arkansas, they're working on that, and other states are looking at it. He'd like to see that go nationwide because really for him, the deal is to bring down the costs that he says come from the pharmacy benefit management system to make it more affordable for the patient when they go to that pharmacy counter. Back over to you.
So, Bertha, doesn't the TrumpRx then compete with what he's doing on Cost Plus drugs? I don't. How did he? Because he said it would benefit them and it would be very big for them.
Dr. Oz has said that he wants to bring all of these things together. TrumpRx is essentially going to be a platform to refer people to the direct-to-consumer providers, particularly from the drug makers. And he's also going to include GoodRx in there as well as Cost Plus. So for Cost Plus, he says if people are going there looking for lower priced drugs, that's going to raise their volumes. It's going to bring more people to them. That's going to allow them to buy more drugs, produce more drugs in some cases, some of the drugs and shortages that they're producing for hospitals, for example. So he thinks that's going to really revive the market. But for a lot of us, paying out of pocket and cash and not having it go towards your deductible is tough. In essence, you're paying twice because you're paying insurance, but it's not going towards that deductible on your insurance.
Makes sense. So actually, this could supercharge his growth because it could bring a lot more volumes. Bertha,
That's
really
what he's
interesting.
hoping.
Yeah. I mean, interesting comments, especially from him, because he's been a big Trump critic. Democrat. And I noted, Bertha, that he said, I'm still not a full Donald Trump fan or something like that.
He certainly isn't, he says, but he's very encouraged by Dr. Oz and the others at the Centers for Medicare and Medicaid. He says, they really get it and they really want to bring down drug prices. And Dr. Oz has said he hopes by the end of 4 years that 95% of drugs in the U.S. will be more affordable for Americans. That is, a high bar to get to. But that is his goal. And, you know, he moves very quickly on this. Last week with the IVF announcement, you had CVS and Cigna sign on to provide on TrumpRx those IVF drugs so that people can find them there. But at the same time, they said that came about and came together in just a couple of days.
Yeah. And GLP-1's on deck. That was the tease from the president. Bertha, thank you. Bertha Coombs.
Yes.